Hello, Colin Hung here for Healthcare IT Today, and I am here at Health 2025 in Las Vegas, Nevada. It's day 2 here, and as you can see from behind me, this is the opening day of the exhibit hall, and boy, has it been exciting. I spent the entire day touring through the exhibit hall looking for interesting companies, and I found a few. And the most interesting one for me today was a company called Opioid. And they make a robotic system that fills a really big gap in the healthcare space. As you know, there's an opioid crisis, and one of the most effective treatments is methadone. However, there aren't enough nurses and there aren't enough places to dispense that, especially in rural areas. And so they make a robotic system that dispenses with a nurse who can telehealth in and treat and dispense that to an individual patient. Very incredible product, and I had the chance to speak with their CEO to learn more about it.
I'm Amber Norbeck. I'm the CEO and co-founder of Opioid, and our mission is to expand access into rural and underserved areas and expand the reach of opioid treatment programs. So what some people don't know is that methadone is only available in 1 in 5 counties in the U.S., and it is the most effective treatment for fentanyl addiction. So what this is Zing satellite, and the point of this is to be co-located in federally qualified health centers, in pharmacies, in correctional settings, in where the opioid treatment program can remotely serve the patients on site. And so how it works is it's directly connected to the electronic medical record. The patient is biometrically ID'd. The nurse approves the doses. The doses are assembled through the robotic automation, and then the nurse approves the dose, and then they are also biometrically ID'd, and the doses are released by the nurse directly to the patient. So this solves the access problem, and it also solves the nursing shortage. There aren't enough nurses in the U.S. to be able to make all the doses. And it's not cost effective for siloed brick and mortar clinics to establish places in these rural areas. So that's what we're out to solve.
Now, while I was also here, I met with an interesting company called Develop Health, and they're doing some work in the prior authorization space, specifically around medications. I caught up with Mel from Develop Health.
We automate medication access, largely for telehealth companies today, expanding into traditional provider groups as well. We do 2 services, we have 2 products, benefit verification and prior authorization. Benefit verification across a list of drugs will say which medications are covered, which ones require prior auth and the estimated financial responsibility. And then prior authorization, after a prescriber prescribes the medication, will automate the authorization for that medication. We typically have customers switching from Cover My Meds to us as a paid alternative. And it's for a few reasons. One, we're provider initiated, so we originate at the point of care rather than being pharmacy initiated. 2, we automate a lot of the work with AI. So we are finding the right forms, autofilling those forms, adding supporting documentation, and then transmitting and following up until we receive a determination. And in case of a denial, we're suggesting next steps accordingly.
Also today, I had the chance to sit down with Talak from CVS Health. He has an incredible portfolio at CVS Health, and I had to ask him a pretty tricky question, and that was, will we look at AI in a few years like we now look at blockchain? If you remember, blockchain was supposed to change the world, but it didn't quite do that. Will we look at AI in healthcare in the same way? And here's his answer.
I think 5 years out, when we look back, Colin, we either would see a completely changed healthcare or a completely broken down healthcare.
Okay.
Those are the 2 options.
Pretty polar.
Pretty polar.
Okay.
Because healthcare as it exists today can continue. We can't afford it. It's delivering bad outcomes. And it doesn't work. The experience is broken. Everybody wants it to be changed. So going back to your question on AI, if we are looking at just AI, I don't think that's sufficient. So
Okay.
if your question is, Can AI alone change healthcare in 5 years from now? No. The answer is a no. But if you combine AI with interoperability, which is exchange of data across all healthcare entities freely, openly, in real time, plus certain structural changes, regulatory, etc., if you combine all those three and rebuild healthcare as AI native, so not band-aiding, not trying to fix here, a thing there, not doing that, but completely redesign healthcare AI native, I think 5 years down the road we'll look back and go, oh yeah, we underestimated what AI could do.
Now, while I was here, I had to stop in and see my friend Jamie Edwards and his company, CVS Health, to get an update on what they've been doing since the last time I spoke with them. And here's just a small piece of that conversation.
Hey Colin, it's great to be here with you today. Awesome to be back with the conference family here at Health in Las Vegas. I'm Jamie Edwards, I'm the President and Chief Strategy Officer at CVS Health. We're a Coastal Ventures-backed startup focused on the senior living and polychronic space, and excited to be here to show you Luna. We launched Luna fully as our MVP this summer, and we have rolled Luna out at 4 different independent living facilities. And we're very excited to start getting the collaboration data and product feedback data back, and we are really making a difference in the lives of seniors by using our little radar dome here, which detects heart rate, breathing rate, and sleep stages, and then we've attached a large language model to it, who really helps our seniors with social isolation, loneliness, and sticking to their care plans.
One of my must-attend sessions today was, of course, the keynote and panel discussion featuring Rasu Shrestha. He talked about the new amazing Living Lab, which is otherwise known as the Pearl in Charlotte, North Carolina. And if you've not heard of the Pearl, I would definitely encourage you to go check it out. He spoke about all the members of the healthcare ecosystem that have come together to put together the Pearl, including the med school, international organizations, to really bring innovation and bring people together to collaborate. And I was really inspired by all the incredible work that the team at Advocate Health is doing, as well as all the ecosystem partners. And I really liked hearing from CVS Health, as well as one of their new startups that have taken up residence at the Pearl. So just to wrap up day 2 here at Health, it's been an exciting day 2. The exhibit hall has been fantastic. In fact, I can't wait for you to see my summary and recap of all the interesting marketing aspects of health. There's going to be a lot to cover, and you're going to be able to see that on our sister publication, Sway Health. That's Sway with 2 A's, .health. And that'll come out probably in the next couple of days. In the meantime, be sure to tune in tomorrow where I'll have my day 3 summary from Health 2025. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.